Good evening, everyone. Actually, I just got the invitation very late, and I had to rush. But when I heard that these two machines will be the first in Africa, I couldn't resist. But as everybody keeps calling him, I'm quite sure this will be a real big success story. And congratulations that you. This is congratulations for everyone. Thank you very much.
Go ahead, please introduce yourself.
Good evening, distinguished ladies and gentlemen, all protocols observed, Honorable Minister, Professor of we are a pace setter really in dermatology. When he was going dermatology, I was going ophthalmology, and we were like, okay, so what's this thing about skin? But we have seen he has clearly distinguished himself in this profession. But most especially, what I want to tell you is that dermatologists are physicians. They are medical doctors who have trained as skin specialists. And there are certain procedures that must only be performed by physicians, dermatologists. I would like you to be very mindful of that, because we have had so many issues of quackery and people who have not been trained to do skin that are doing skin. So anything that has a name like laser or dermabrasion, anything that would disrupt the skin, or injections, or fillers, or Botox. What's the other one? They are supposed to be, if you want these procedures and you go somewhere, please make sure that the person performing is a doctor. Otherwise, if there are complications, you will have nowhere to report to, and you will have nowhere to seek justice. But if there are doctors and there are complications, for ladies to seek, or for anyone looking for skin care, should please go to the right person so that we can avoid complications. Congratulations, Dr. Bashir. Congratulations. This is a marvelous thing. I think this is the best thing that can happen. We're always excited when we have new things coming into Africa, and especially if there is a program or a system of introducing more and more and more. Thank you very much, and it will help a lot of us.
Say something. You don't want to say something?
The Honorable Minister, all protocols observed. This is a day I'm very happy. The dream we have been pursuing for dermatological practice in Nigeria is coming to fruition. Dr. D, congratulations. Mr. Pondi, congratulations for introducing this new technology to Africa. For my discussing and looking forward to bridge that gap between the academia and the industry. For us to develop, there has to be some synergy, some collaboration between the academia and the industry. The academia will be the brain, they will bring the ideas, but you need the industry to bring the. So this is just the beginning. Hopefully, as we develop, as our economy expands, more technology transfer is going to occur, and we'll raise our practice from the rudimentary practice of just that is where our population is heading towards. We have a developing population. We have a population like this came, but we need the technology, and we need the support of the industry to do so. So that's the reason I congratulate Dr. D and Quanta System for being in the vanguard of this project. Thank you very much.
Thank you very much, all. We really appreciate it. Thank you very much.
A round of applause here. Yes, because it's in my portfolio. I am from Upnote, and I was able to touch a machine that is the first of its kind in Africa. Thank you very much. So you might want to come later when refreshments going round. You could just come around, take a look at it. And most especially, it's important that we know that referrals is very important. A lot of people may know about this, but it's good to talk about it. It's good to my very distinct honorable minister mentioned that it's important that these things are done, and it's an issue that people have. Maybe they don't want to come out and talk about it. So thank you very much, Mr. Pondi. When you go back to Italia, more machines for this, okay? Yeah. The before and after, okay? The before and after, and I'm still going to call back. Okay. Oh, yes. Excuse me. All right, so ladies and gentlemen, now we're going straight to the multimedia. This is where you get to watch what these machines do to you.
But also durable. Good evening and welcome.
Can we dim the
to
lights
our
if
a cure
just in case?
acne laser
Thank
talk
you.
webinar. I'm experienced. I'm also the medical director of Refine Aesthetic Center, and I wanted to announce tonight that we have a new tool in our belt to help treat and fight acne. There's a so-called new light in the fight to treat acne. We're extremely excited about this, and we wanted to introduce this to our patients and people in this area. As many of you know, acne affects many people. It affects various body areas, and it can cause pain and discomfort, as well as leave scarring. It can greatly affect people. Over the years, we've had many treatments for acne, aiming at different areas of where acne is formed. However, this is a great breakthrough in technology to help treat that. And I can tell Dr. Rox Anderson, and he describes it a little bit more. Him and his colleagues with Dr. Sakamoto and their other team members spent many years developing and perfecting this technology.
Around the late 90s, I looked in the mirror and said, I want to cure acne. I don't care how I do it, I just want to do it. I'm Rox Anderson. I'm a professor of dermatology at Harvard Medical School. I practice at Mass General Hospital, and I am the director of the Wellman Center for Photomedicine, which is the world's largest lab where we study light. The Wellman Center itself has launched a lot of things that are now helping people. Starting a long time ago, we figured out that pulses of light could be used to selectively target microscopic things inside of tissue. And what got me started was taking care of kids with port wine stains. We made laser tattoo removal, we invented laser hair removal in the mid-90s. We also occasions, laser technology has really moved far. I'm happy to talk about acne. Sadly, it's still the #1 skin disease. And I say sadly because there's been a lot of brilliant work that's gone on. We have drugs, we have an understanding of what's going on with what causes acne. It's still very common, it's a pesky problem. The drugs have significant side effects and it interferes with social life. It's also the #1 cause of scarring on the face. The story with Accure starts really with the people that are currently running that company. I had this stuff in my head about wanting to come up with a laser that would actually work for treating acne. And Christopher Carlton and his colleagues literally showed up one day and said, Rox, what would you like to do? It was a carte blanche. And I said, let's cure acne. It wasn't clear at first, can we pull this off? Can we get enough power, the right pulse duration? We had to figure out a sequence of optical pulses that would target the gland safely and effectively. A few twists and turns along the road, but then we finally got where we're going. The Accurate Laser is doing its job. It's doing it within a fairly narrow window of efficacy and safety. The efficacy of this laser to come in a fairly short time, you realize it's 3 or 4 treatments spaced a month apart. This laser is in a way colorblind. So many of the lasers are difficult to treat people of color because they're at wavelengths that are absorbed by melanin. This wavelength is not absorbed at all by melanin. So I think you will see a wide spectrum of benefit across the skin types. I think of durability as just simply how long does a treatment that's effective really work? And I think the answer will be that this is very durable response. A lifetime of acne scarring is a big deal, so I view this as preventative, which is another form of durability. My experience in the past has been that if you come up with something that really works and it's brand new and we don't have it, that somehow the world organizes itself in a way that allows it to get out the door. And you know, that's I think going to happen.
So when you look at acne, I think it's important to understand how acne happens or is formed. So when you look at the skin, acne is much more common in areas where we have increased sebaceous glands like the face, the neck, the chest. In the sebaceous glands, or the oil-secreting glands, that make a product called sebum, which moves up our follicles and comes out on the skin and has a good purpose because it helps lubricate the skin, which we all need. It comes out through that opening along the pore, and as time goes on, we do have shedding of these epithelial cells along this follicle, and normally they migrate nicely up to the trap that sebum in there, which causes acne. In addition to that clogging, you also have bacteria on the skin that migrate down this follicle, and when they get involved and intermixed with the sebum, create significant inflammation, and that's where you get the redness and the discomfort that comes with acne. So depending on the level where you plug along the follicle, you can have things like whiteheads. If it's more superficial, the keratin can get oxidized and give you the so-called blackhead. As there's more inflammation, you can also get pustules, or sometimes you can get the deep cysts. The more inflammation, the deeper it is, the more chance that you have at scarring. So over the years, we've had many treatments, topical treatments, pills, various things, to work on the different levels, such as the plugging, the bacteria, the inflammation, and all of them have a role. But as most of you know, you have to be on those for many years sometimes. Sometimes they work, sometimes they don't. And this is the first time where we've really been able to use something to greatly target the sebaceous gland and try and get a long-term result. Now, we do have a medicine called Accutane that does work some on the sebaceous glands, and it does work for acne, and it's been the gold standard for. So when you are using it as a special handpiece, and when it cools the epidermis to a certain temperature, the laser beam is emitted in pulses to target in the area. And as you can see from that schematic, the epidermis, the outer layer of the skin, and the dermis are protected from this. And so you're putting all the energy where it needs to go. And that is where they spent most of their time doing the research. So if you look at it, they studied this, and in their clinical studies, they showed significant improvement in these patients. Generally, it's done as 4 treatments, and what they noticed that after the first treatment, there was already a 40% improvement in the majority of the patients. I think the data is out to almost 3 years now where these patients, so it looks like it's not only comfortable while they're treating. Once we have the numbing medicine protocol completed, it's cleansed off, and then we do adequate treatment of all the areas that need to be treated. So it's all mapped out with a grid. Protective eyewear is placed on the patient as well as all the staff, and all safety protocols are utilized. We then start the treatment, and we follow out this grid pattern to make sure that we're evenly treating all these areas. A treatment takes approximately, depending on the area, approximately 45 minutes or so. The nice thing about this, like being transmitted down deeper where the sebaceous glands are, and we're protecting the epidermis, so we don't have to worry as much about, see pretty significant improvement after 4 treatments. We're going to have time then for a few questions and answer. I'm going to put on my glasses as they come in. So the question is, how long do the results last? Well, we know from the clinical trials that it's approximately 3 years at this point. And the reason we know what it appears is the results are durable, and be a few patients that may need help make their skin look a little bit better, like using Retin-A and stuff. But for the most part, it appears to be a durable, long-lasting result, which is quite. We can treat any area that is involved with acne. So most commonly it's the face. But now the one important thing in numbing medicine, we have to be careful on the amounts that we use so we don't have any problems with, like all those areas can be treated. This is the discomfort level. So as we all know, pain is subjective, and so everybody has different responses to pain. But in all the studies and in our clinical patients that we have treated, it tends to be mild discomfort. And from our office, we'll get back to you. Very excited about. We think it'll make a very big.
Round of applause, ladies and gentlemen. And I just want to let you know that works. Somebody say, yeah, as you're eating food, y'all gonna watch how the Discovery Pico, how it works. So it round of applause, ladies and gentlemen. Wow. A round of applause, ladies and gentlemen. Wow. Wow. Quickly, I would like to welcome Dr. Bashir to come and take the before and after. And we were just watching the videos, and I emphasize that there are certain things that perhaps maybe people may not really get. I really need him to say though.
What to do now is to show you our results with the laser, the same laser. So we have some of our patients with a tribal mark. This was after 2 sessions of Pico. This was the left. I know a few people who have something like that and they may wish to take it out. We are always ready and available if they ever want to take it out. The next slide, please. So this is one of the problems we have in Nigeria. After prolonged use of so many things, you end up having a low patch skin, dark patch here, lighter patch here. But this is one of the results of the Discovery Pico. And this is, I'm really sorry the pictures are a little bit blurred because the screen is wider here. Next, please. So a lot of people after surgery, it's very common now, it's very vogue to do scars. So this was a scar before treatment. This was a scar after 2 sessions of Pico. Yes, you may have noticed that she has white patches. No? We had to do laser assisted drug delivery, so we had to include that. And this is a side effect of the injection we gave, which, yeah, I don't know how visible it is the one that has shrunk to this, and the one here is the one here. Next slide, please. This is another scar before and after 2 sessions of Pico. There's no intralesional or topical steroid here, just Pico. Next slide, please. Acne scar, of course, a very debilitating condition. This is before and this is after 1 session, actually. I even wanted to say 2. This was after 1 session. This is the other side of the same patient. So this is a surgical scar. Another scar, 2 sessions. And yeah, so this is another one. I'm not really sure if the pictures are good enough, but I think it is visible that the difference is remarkable. We have the smaller version of the pictures. For anybody who wants to have them, we can send them to him so that they can actually appreciate the difference. This is another scar, hyperpigment, and of course tattoo. This is after 1 session. This is the before and this is after 1 session. I'm sure you can see there's difference between this one and this one. And in tattoos, of all the treatments, the scar treatment is not only done once. You have to do it once every month, maybe depending on the response, 2, 3, 4, 5 sessions, depending on the response you get. And not. This is the last one, right? Yes. So I just wanted you to have a feel about using it in January, and we would have our results, but you've seen the results of other people who have been using it. Excuse me. And the Pico, and I'm sure eventually we would have a catalog of more results as we use them and improve on what we have gotten so far. Thank you very much. Now, if anybody has any question or any comment, it's open. I mean, you can ask. You don't have to be a doctor. You can be a patient. You can be some.
Thank you.
To start by congratulating Dr. Bashir on this wonderful milestone for his business. listeners and for the rest of us who will be beneficiaries ultimately. Very close to me, has been battling for many years now. It is called, forgive me, this is a very interesting medical term, hidradenitis suppurativa.
Okay.
Also known here, I'm looking at the internet.
It's hidradenitis suppurativa.
Also known as acne inversa.
Yes.
Acne, and we've been talking about acne all night. So, will this, thank you very much.
Thank you very much for your question. Hidradenitis suppurativa is not the same as acne vulgaris. And your question is very interesting because we have discussed that even among forms, bumps, oozing, pain, and so on, and so on and so forth. So this laser, the Acure laser, does not treat hidradenitis suppurativa. For the main reason, the Acure laser treats, okay, so acne is a result of oil, and the laser works on that refinery alone. Hidradenitis suppurativa has a different reason for coming up. So this laser cannot treat that. Hidradenitis suppurativa is a very frustrating, mildly as bumps. So what we do, part of the treatment we do when it is an early stage, we also use a laser, but a different laser from these two. We use the laser for hair removal. Because hidradenitis suppurativa, the condition is related to where the hair comes out. I wouldn't want to bore everybody with what happened and how it happened, but generally, you take oral drugs and you do laser for hair removal. This laser does not help hidradenitis suppurativa. I hope it's a bit clear. They are already working on that because it affects more white people than black people. So for that reason, of course, they would stay awake and make sure they create something. Any other comment or question, please? Please, the floor is for everybody. Don't be shy. I mean, you can ask whatever you want to ask. If I don't know the answer, I will tell you I don't know. Yes, okay. So there's a professor here that wants to... I forgot.
Dr. B, thank you for the excellent presentation, along with your team. Going down to the grassroots, to the basis, how much does it cost?
So you mean how much the machine costs or how much a procedure costs? Both. Expensive. At about somewhere between 350 to 400,000 euros. Now, that aside, when you have the machine, you start the procedure. So our idea, and that is why Mr. Alex said we have a project, Africa machines, and ask Nigerians to pay Nigerian price. So let me give you an example. In Europe, or in the US, one session of the IKEA is about $1,000. So for 4 sessions, $4,000. But we cannot, even Nigerians can benefit from a world-class treatment at an affordable rate. Thank you. Any other question or comment? Yes.
Thank you very much. I'm Abel Onunu. Mine is actually a fear. Is there any way we are going to prevent Nigerians from using the ones for treating hyperpigmentation from bleaching their skin?
Very much, Prof. Coincidentally, I was at one of the TV stations here present, Global TV, and each time I go to the TV station or radio station, the same question pops up about bleaching. So bleaching, I think, is a pandemic, maybe an epidemic, maybe a local thing, not only in Nigeria, but they say it as doctors, the consequences of bleaching. One of the consequences is one of the patients that I showed with a dark patch. Bleaching constitutes a health hazard. The skin is the largest organ on the body. It is the protector. In effect, you are harming the rest of your body. The second thing is whatever goes into the skin can be absorbed and it can affect your other organs, your kidney, your liver. But the most important thing is it is even obvious. You bleach, then you have a rebound effect because whatever you use reaches tachyphylaxis. That means it cannot go beyond that and then comes back. Now, some of the problems we have, I was talking with the head of all the doctors in Nigeria and we talk about that. Some of the problems we have are regulatory problems. You and I cannot do anything about it. Our job is to try to enlighten out. Your skin will become so fragile that you may not be able to be treated, and so many other consequences that you know with as a problem to us, and we can't stop talking about it. Sometimes you are surprised even doctors come to you with bleaching creams. Yes, so it's something that is a huge problem. We just need to continue talking about it, and maybe someday something may happen. Now they are exporting Nigerian bleaching creams to other African countries. Yes.
Good evening, everyone. So now we've gone to bleaching. Actually, this week, it's still this week. This week, that's on Tuesday, the Nigerian Association of Dermatologists actually launched a campaign on anti-bleaching. That's skin bleaching now. You know, now you can bleach your hair, bleach everywhere, but we are more concerned about bleaching.
Any other comment? Oh, okay, there's somebody there.
Okay, in terms of reducing sebum production long term, is the Leaser preferred or rather compared to isotretinoin?
So in the presentation of Acure, the doctor mentioned that Acure was specifically, part of the advantages is to make sure, to stop people from using isotretinoin. Isotretinoin has a lot of side effects, and the Acure works on the same level or even better than isotretinoin without those side effects. I think the doctor mentioned it in the presentation. Yes. So when you are thinking of taking isotretinoin, you may consider doing the Acure. Yes. Any other question? Or so I can get off. Okay, so one of the doctors is asking if we can partner, because of the cost, if we can partner with teaching hospitals or institutions so that tuitions. Yes, of course, it depends on the type of partnership. It depends on how much money the institution is going to come up with. Centers of excellence. But yes, it's something we can consider depending on what they can come up with. We have the quantum manager for Africa here, and it's something we can discuss. They are willing and really ready to help us. But of course, there are limitations. Yes. Any other comment or question?
Good evening. My question is, My question is to Niger Technology into Nigeria. What are your plans in terms of maintenance of the equipment that are based in Nigeria? Thank you.
So we are the sole distributors for Quanta lasers, and coincidentally you're asking a question which is that service these lasers, that attend to any problem that comes up with these lasers. Unfortunately, because of the difficulty in for Nigerians to get visas to Europe, we have had we're doing. Eventually, one day they may get visas and they may travel to Italy, because the thing is with Quanta, you can send your engineer to spend a week, 2 weeks in Quanta and learn everything about fixing the lasers. That is one of their benefits. That is one of their principles, to train. But unfortunately, not everybody can get a visa travel to Europe from Nigeria, especially when you're young. But we have found a way around solving that problem. And thank you very much for asking that question.
Okay. My question is, when we have patients that are already on isotretinoin, there are some certain treatments we can't do for them till. So when it comes to acute laser, is there any concern about that? Do they have to stop, or can you just do a combination treatment?
So you can do acute laser 1 week after isotretinoin. Yes. And besides, your patient would be happier with you when you start the acure. They would not have all the side effects of isotretinoin. Yeah.
Thank you, Dr. D. I just want to find out which is it all aspects of acne lesions that acure can treat? Comedones, papules, nodules, cysts. Which particular ones does it do?
So yes, it cures everything from papules to pustules to nodules to nodulocystic, everything, all stages of acne, except of course where there is only seborrhea without lesions. But otherwise, and even in that case, if you have excess sebum, the acure can fix it, because the whole idea, it works on the sebaceous gland, and that is the precursor of everything. Yeah. Any other question or comment? So I can get off?
Okay.
Thank you very much. Thank you very much.
Thank you. Please, a round of applause for Dr. Bashir. I was just telling Dr. Bashir, just in case, these machines need advert. So if we need to do this advert, for example, in different countries now, there will be different ways of advertising these systems here. It sounds like this. We are welcoming you to a very interesting quantum system machines right here in India. This is Discovery Pico, very good in removing pigments, tattoo and any travel mark. A round of applause for these two wonderful machines. And then you have somebody with baritone will come. जिंदगी मेरा प्यार मोहब्बत के लंडार को डिस्कवरी पिको पिको लंडार को आक्योर कोस के बस के लग रहा वट के नोर के बद दुश के ले मारे नंडार के लोरे बोले Johnny man. Before you know, the advert is done. When you go to Italia, okay, you come to Italia, you get Discovery Pico and Acquarea, okay? Hey. But when you go to places like London, all right, it's a perfect Saturday. We've got two beautiful systems down there. And it's going to be one of the best. Like, if you want to move all the tattoos, you want to go slip, disappear in one day. You know what I mean? Yeah. You know what I mean? All right. But when you go to America, yeah, this is down here talking about Discovery, Pico, and the cure down here in America. Somebody say, we take away all your tattoos and anything that your mama doesn't like, we make sure we take it out. Somebody say, When you come to Nigeria, take it to the east. The first thing you go hear, what we are telling you right now, this two machine now just arrived from container. If you want to remove a tattoo that you did in secondary school, this is the right machine. Now just call my number, not 8 not. When you carry it,
microphone. You want to mess me up? I beg you, I want to advertise machine. Yeah, give me my microphone. If you, ladies and gentlemen, we are here alone. Surely this machine is very, very tantalizing. I am telling you. By the time you I beg you for what you want. So this machine, even if your money is not enough, come to the office. We can discuss something. I will collect your money. Will give you the service. And this is something that you cannot, if you take more enough, if you call it discovery. But when you take it to the house of land, chop. I want to say that here we have a machine. This machine is very, very good. And for the fact that you have a terrible mark or a scar on your body, all you have to do, like I said the other day and the other day, you just come here, I speak to Dr. Bashir, and before you know, check you are finished everything here. Thank you very much. So it can go on and on. The interesting one is the Chinese people. The first 5 words you don't understand. You just hear, we are trying to tell you right now that this discovery, Pico and Q, they are going to cure your issues of acne to know something out there. So ladies and gentlemen, round of applause for yourselves. We're having a very good and a beautiful evening. Please, like I said, I mentioned earlier, this is all about referrals. If you have issues with acne, pimples, some of the terminologies here used are a little bit, professional. But the direct one is we solve any skin issue. From pimple, eczema, inside, exposed or within. This is a very, very interesting machine, and we're so excited to be part of this lunch. We want to appreciate Niger Med Skincare for doing everything possible to assist and help and disseminate such. Like we said, I want to make sure everybody has eaten. Things are going around. So we'll just take a few minutes musical interlude, and then just in case the program was live and I didn't make my proper introductions. My name is Abdul Bulam Asmai. I'm a lecturer at University of Maiduguri, and I've been a family to the Bashirs, and I want to appreciate you all. It's good to be in Abuja City here, and I'm an expert with an accent. Somebody say, no, thank you very much.
Introduction of the acne machine and the Pico machine is more than a technological upgrade. It is a testament about where modern dermatology, science, and patient-centered care work hand in hand to deliver faster, safer, and more effective results. For dermatologists, they offer new confidence in tackling conditions that have long challenged traditional methods. For patients, they promise renewed hope for clearer skin, improved texture, and treatments that honor both biology and their individuality. As this machine begins their journeys from the lab into clinic, stand as a defining step towards a world where advanced technology does not just treat the skin, but transform lives. From A-Class Event Center in Abuja, I am your host, Kikelomo Okeri.
Me and Romeo ain't never been friends. Can't you see how much I'm really loving? Gonna sing it to you time and time again. Oh, Casanova, Casanova, oh, Casanova, Casanova. Every man deserves a good moment, and I want just a woman just like you in my life. So let me love you. Say you up and said I want to hold you, baby. So let me squeeze you. Don't you know that I'll get down on my knees for you, baby? You see, I ain't much on Casanova. Me and Romeo ain't never gonna say it to you time and time again. Oh, Casanova, Casanova. Everybody's gonna win, yeah, yeah. If only you just believe, yeah, yeah. Close your eyes and come and see.